Access Faucet, a transformative initiative dedicated to empowering individuals through the principles of sustainable One Health. This program recognizes the deep interconnectedness of animal, environmental, and human health, affirming that a holistic approach is key to well-being. Our program is designed to equip individuals with essential health knowledge, enabling them to become custodians of their own well-being. Through our hybrid Learn-to-Earn sessions, conducted both virtually via Google Meet and at physical locations, we engage participants from diverse backgrounds. These weekly sessions serve as dynamic platforms for learning, discussion, and collaboration. We focus on the co-creation of knowledge through the Learn One, Do One, Teach One approach. This method ensures that each participant not only learns valuable health information, but also applies it and teaches it to others, fostering a ripple effect of empowerment and education. By participating in the Actuate Health Access Program, individuals gain the tools and knowledge needed to improve their health and the health of their communities. Our goal is to create a network of informed and proactive health custodians who can address health challenges in a sustainable and impactful way. Join us in this journey towards better health for all. Together, we can make a difference. Welcome to the Actuate Health Access Faucet, a transformative initiative dedicated to empowering individuals through the principles of sustainable One Health. This program recognizes the deep interconnectedness of animal, environmental, and human health, affirming that a holistic approach is key to well-being. Our program is designed to equip individuals with essential health knowledge, enabling them to become custodians of their own well-being. Through our hybrid Learn-to-Earn sessions, conducted both virtually via Google Meet and at physical locations, we engage participants from diverse backgrounds. These weekly sessions serve as dynamic platforms for learning, discussion, and collaboration. We focus on the co-creation of knowledge through the Learn One, Do One, Teach One approach. This method ensures that each participant not only learns valuable health information, but also applies it and teaches it to others, fostering a ripple effect of empowerment and education. By participating in the Actuate Health Access Program, individuals gain the tools and knowledge needed to improve their health and the health of their communities. Our goal is to create a network of informed and proactive health custodians who can address health challenges in a sustainable and impactful way. Join us in this journey towards better health for all. Together, we can make a difference. Welcome to the Actuate Health Access Faucet, a transformative initiative dedicated to empowering individuals through the principles of sustainable One Health. This program recognizes the deep interconnectedness of animal, environmental, and human health, affirming that a holistic approach is key to well-being. Our program is designed to equip individuals with essential health knowledge, enabling them to become custodians of their own well-being. Through our hybrid Learn-to-Earn sessions, conducted both virtually via Google Meet and at physical locations, we engage participants from diverse backgrounds. These weekly sessions serve as dynamic platforms for learning, discussion, and collaboration. We focus on the co-creation of knowledge through the Learn One, Do One, Teach One approach. This method ensures that each participant not only learns valuable health information, but also applies it and teaches it to others, fostering a ripple effect of empowerment and education. By participating in the Actuate Health Access Program, individuals gain the tools and knowledge needed to improve their health and the health of their communities. Our goal is to create a network of informed and proactive health custodians who can address health challenges in a sustainable and impactful way. Join us in this journey towards better health for all. Together, we can make a difference. Welcome to the Actuate Health Access Faucet, a transformative initiative dedicated to empowering individuals through the principles of sustainable One Health. This program recognizes the deep interconnectedness of animal, environmental, and human health, affirming that a holistic approach is key to well-being. Our program is designed to equip individuals with essential health knowledge, enabling them to become custodians of their own well-being. Through our hybrid Learn-to-Earn sessions, conducted both virtually via Google Meet and at physical locations, we engage participants from diverse backgrounds. These weekly sessions serve as dynamic platforms for learning, discussion, and collaboration. We focus on the co-creation of knowledge through the Learn One, Do One, Teach One approach. This method ensures that each participant not only learns valuable health information, but also applies it and teaches it to others, fostering a ripple effect of empowerment and education. By participating in the Actuate Health Access Program, individuals gain the tools and knowledge needed to improve their health and the health of their communities. Our goal is to create a network of informed and proactive health custodians who can address health challenges in a sustainable and impactful way. Join us in this journey towards better health for all. Together, we can make a difference. Welcome to the Actuate Health Access Faucet, a transformative initiative dedicated to empowering individuals through the principles of sustainable One Health. This program recognizes the deep interconnectedness of animal, environmental, and human health, affirming that a holistic approach is key to well-being. Our program is designed to equip individuals with essential health knowledge, enabling them to become custodians of their own well-being. Through our hybrid Learn to Earn sessions, conducted both virtually via Google Meet and at physical locations, we engage participants from diverse backgrounds. These weekly sessions serve as dynamic platforms for learning, discussion, and collaboration. We focus on the co-creation of knowledge through the Learn One, Do One, Teach One approach. This method ensures that each participant not only learns valuable health information, but also applies it and teaches it to others, fostering a ripple effect of empowerment and education. By participating in the Actuate Health Access Program, individuals gain the tools and knowledge needed to improve their health and the health of their communities. Our goal is to create a network of informed and proactive health custodians who can address health challenges in a sustainable and impactful way. Join us in this journey towards better health for all. Together, we can make a difference. Welcome to the Actuate Health Access Faucet, a transformative initiative dedicated to empowering individuals through the principles of sustainable One Health. This program recognizes the deep interconnectedness of animal, environmental, and human health, affirming that a holistic approach is key to well-being. Our program is designed to equip individuals with essential health knowledge, enabling them to become custodians of their own well-being. Through our hybrid Learn to Earn sessions, conducted both virtually via Google Meet and at physical locations, we engage participants from diverse.
I think we can get started. Good evening, everyone, and welcome to today's Access Learn to Earn session. This is the seventh session of cycle 4. Yeah, and in our previous sessions, we have learned the key barriers that our patients face in healthcare delivery, and we normally have these sessions from 8 to 9 every Thursday, where we engage in discussions on how we can get to the future that we truly want in healthcare, taking into account the current challenges and how we can use blockchain, this emerging technology that is blockchain, to surpass these barriers. So today we are still continuing with the conversation, and today we are privileged to have a guest speaker who is a nursing officer, Mr. Abdallah Mwita, who will be taking us through the topic strengthening primary health care in Kenya. So before we start, allow me to take you through the meeting agenda. We will start by topic presentation by our topic master, who is Abdallah Mwita. And then after that, we will have a privilege to hear from our CEO, Dr. Macharia Waringi, who will give us additional notes and comments about the topic. And thereafter, we will have an interactive session. You can ask questions, give your opinions. Yeah, and after that, we will have pre-Boston Nairobi Summit announcement from the summit president, Mr. Augustine Narokwe. Thereafter, we will conclude the meeting. So I encourage all of us to be keen and to engage. So now I will welcome our topic master to take us through the topic. Abdallah, you're welcome.
Thank you so much for welcoming me. I hope you can hear me.
Yes, we can hear you.
Okay, I'll try sharing my screen so that you can get the notes that I have, the presentation that I have, so that you can all see. Can you see my screen?
Not yet.
Okay, let me know when you can see it. How about now?
Yes, we can see now. Go
Okay,
ahead.
thank you. So my name is Abdallah Mwita. I'm a nursing officer intern currently at Gatundu Level 5 Hospital, and I'm privileged to be your topic master today. So we'll be talking about strengthening primary health care in Kenya, and we'll go through its impact, the challenges, and potential solutions. And I'll get straight into the presentation now. So first of all, we need to understand what is primary healthcare. And it's an essential healthcare made accessible, acceptable, and affordable through full participation of individuals, families, and communities. The key components of primary healthcare are health in policies and sorry, just a minute. Okay. The key components of primary healthcare are health in all policies, which is empowering individuals, families, and communities by integrating health services. Why do we focus so much on primary healthcare? It's because it provides with high quality, low cost of care to individuals and families. It also supports more equitable distribution of health and reduces health inequalities. Primary healthcare also serves as an early warning system to detect and stop disease outbreaks. Another importance of PHC is that it empowers individuals, families, and communities to make decisions about their health. PHC also improves health by providing access to more appropriate services and also amplifies efforts to improve health across lifespan from birth to old age. The role of the government in implementation of PHC is through creating enabling environment through laws, regulations, policies, and strategies. It has also a role in capacity building and also providing financial support so that we can meet the PHC criteria. It also promotes awareness and education through workshops and through social media, and it also offers health services and addressing social determinants of health. In Kenya, health services are classified in this manner. There are levels whereby level 1 is community services, level 2 is dispensaries and clinics, level 3 is health centers, maternity, and nursing homes. Level 4 are sub-county hospitals and medium-sized private hospitals. Level 5 are county referral hospitals and large private hospitals. And level 6 are national referral hospitals. It's also classified in terms of public and private, whereby the public is run by the government and private is for the profit healthcare providers. And there's also faith-based hospitals that are run by missions and clinics operated by religious organizations. So what are the packages available in PHC in Kenya? The first package is promotive, which includes consoling and health education and awareness. This is the first level. Another service package is preventive. This will compromise health. This will comprise of primary, secondary, and tertiary screening immunizations. There's also chemoprophylaxis and adherence monitoring. There's ambulance and emergency response, acute ambulatory care. This is the healthcare given to walk-in patients that are stable. There's also a package of chronic diseases care that includes palliative care, which is driven to patients with terminal illness such as cancer, that is graded stage 3, 4. Rehabilitative care given to persons with disability from any cause to improve the quality of their lives. The role of communities in primary healthcare. Communities have a role they're essential partners in PHC because they participate in community dialogues. They also have, they support community health promoters that we have seen recently being rolled from the word CHV, which is community health volunteers, to community health promoters. And they also seek care at the nearest health facility when sick. They contribute to addressing social determinants of health. And they also support development of local health facilities and delivery of services by healthcare workers. The impact of PHC in Kenya. So since PHC was rolled in Kenya, there has been an increased access to healthcare. As you can see, there's some journals that have cited there that back up that there's increased access to healthcare in the community level. And in short, this PHC brings essential services closer to the people, especially in rural areas. Another impact that it has had is improved maternal and child health. And all this is backed up by data. Primary healthcare program also mainly focuses on prenatal care, skilled birth attendance, immunizations, nutrition counseling, leading to reduction in infant and maternal mortality rates. PHC also has an impact on disease prevention and management, whereby early diagnosis and treatment of common illnesses like malaria, tuberculosis, and HIV and AIDS through primary healthcare can significantly reduce the disease burden. It has more impacts such as family planning promotion, whereby it provides family planning services, enabling individuals to make informed reproductive choices, hence controlling the population in an organized way. It also has an impact on community engagement. This is through utilizing community health promoters to deliver health education and outreach programs that fosters community participation and empowers individuals to manage their health. Its other impact is cost effectiveness. Investing in PHC is considered as cost effective as it prevents complications from diseases that could require more expensive treatments at higher levels because they are detected early. So those were the impacts of PHC, and we will move on to the challenges that are faced, that PHC faces on its delivery. The first challenge is funding and resource constraints. For this year budget, there's an improvement from the past years, whereby I found out that 11% of the Kenyan national budget was allocated to health, and that's a good way forward. I'm not sure, but I think WHO requires that at least the national budget be that is allocated to health should be more than 10%. I think we can clarify that. And also there's a scarcity of supplies and equipment. Essential medicines and medical supplies are often in short supply, affecting service quality. Inconsistent funding, dependency on external donors to enable funding, making it PHC unsustainable in some regions. For example, if some international organization withdraw their funding, in Kenya, we will find a lot of trouble running our healthcare industry. High out-of-pocket costs. Many patients are forced to pay significant amounts out of pocket for healthcare services, deterring them from seeking necessary care. And there's also limited health insurance coverage. It's an issue, like as of now, we have an issue that we are rolling out from NHIF to SHA, and it's a problem to many, it's a challenge. So the reach to health insurance schemes is often inadequate, leaving many individuals financial protection for healthcare needs. Another challenge that PHC faces on its delivery is workforce shortages. Lack of trained healthcare professionals. Kenya has a shortage of doctors, nurses, and community health workers, especially in the rural areas, whereby you may find that there's only one clinical officer and maybe 3 nurses running the facility, which brings them to a high burnout. There's also high workload and burnout. Overburdened staff face high patient to providers ratio, reducing service quality and morale. So as a country, we are not yet to the targets that WHO has set for us for the doctor to patient ratio, nurse to patient ratio. This is a challenge in seeing the PHC, the objective of PHC met. There's also another challenge of migration of healthcare workers. Skilled professionals often leave for better opportunities abroad, further straining local PHC system. And we can see that in Kenya, especially in nurses. They're living in numbers to go abroad where working conditions are better. And this is a challenge in delivery. There's also an uneven distribution of healthcare workers, where most healthcare professionals tend to concentrate in urban areas, leaving rural communities underserved. Another issue on workforce is poor training and retention. There's also a challenge in infrastructure and accessibility to the community. There's many remote communities lack health facilities within accessible distances. So when a person needs an essential service, they have to walk a very long distance in order to find a service that will otherwise be provided closer to them. There's also poor transportation and connectivity. Limited roads and transport make it difficult for patients to reach clinics, and inadequate health facility infrastructure, which may lack proper sanitation, electricity, and essential utilities to make a hospital run. Another challenge is data management and health information systems. lack of digital health records, whereby we still rely on paper records, making patient data management inefficient, especially at this current world. Inconsistent data collection and analysis. Limited data impacts decision making and resource allocation of PHC, because you don't know which hospital lacks supplies and which one needs more human resources, because there's no data to show you. There's also privacy and security concern, where there's limited technology infrastructure affecting the secure handling of sensitive health information. So those are the challenges that PHC faces in Kenya. And here are some of the innovative solutions that can address the challenges. First of all, we will go through the funding and resources constraints. The government can increase allocation, their yearly allocation of the budget to health. And as healthcare providers, we can advocate for higher health budget, aiming for at least 10% of the national budget. In this way, the program of PHC will receive more funding. We can also do public-private partnerships, whereby we collaborate with private entities and NGOs to supplement funding and resources. And another thing that we can do, especially for a country that we all know that corruption is an issue, and blockchain is here with us, and it can help us in transparency. We can use it to track donor funds and ensure transparency in distribution of funds. There's also incentivized community contributions. Encourage local contribution through microinsurance and savings programs to enhance self-sustained PHC funding. On the challenge of workforce shortage, these are some of the innovative solutions that we can have, such as telemedicine solutions. These are things that have been used in some countries like USA, and they're working. So we can also try that and incorporate it in our Kenyan system. Through telemedicine, we can extend carriage, allowing urban doctors and consultants who are usually minimal in our countries to support rural practitioners remotely. Another thing that we can do on workforce shortage is training programs with AI support. We can implement AI-based training platforms to rapidly train healthcare workers in essential skills. For we know that we are in an era where AI is advancing at a very high rate, and it can help us in training these healthcare providers that can make their skills better. The country can also introduce incentives like career development opportunities and better working conditions to retain healthcare professionals. This is through giving them promotions and giving them allowances on their basic salaries. These are also, you can leverage task shifting, empower trained community healthcare workers to handle basic tasks, reducing the load on doctors and nurses. Some of the tasks that community healthcare workers can be trained on is such as taking blood pressure measurements and teaching them that there's a limit that shows that this person is prehypertensive, this person is hypertensive, and showing them the correct referral method on where to find help in case of anything. Another training that they can also be done on is blood sugar measurements. And you can teach them on the ranges of pre-diabetic patient, a diabetic patient, and also on the referral mechanisms. on where they can find the best possible care as soon as they can, because this is a goal in PHC whereby we aim at prevention level and not at a higher level such as the palliative care. We mainly measure at preventive measures. Another innovative solution on infrastructure and accessibility is by deploying mobile clinics in remote areas to reduce travel burdens on patients. A patient in a rural area doesn't have to travel for so many kilometers in order to find a place where they can do a malaria test and get help where is needed. So mobile clinics can help in doing that. Another solution that we can come up with is through digital health kiosks. And this is through setting up digital health kiosks in remote communities for basic checkups. These are blood pressure measurements, blood sugar measurements, weight to height, so that they can find their BMI, which can be supported by telemedicine consultations. Another thing that we can do on infrastructure and accessibility is through blockchain-based logistic tracking. Use blockchain for efficient tracking of medical supplies and transportation routes to remote areas. For we all know that blockchain is a transparent innovation, and in that manner, everyone will be contented that the supplies are at the right place where they should be. Another solution that we can have is infrastructure grants and investments. We can advocate for more international and local investments in infrastructure to improve roads, sanitation, and facility maintenance. So another solution that we can come up with in enhancing data management and health information is through electronic health records system, through implementation of national health electronic health record system using blockchain for secure, unified data access. We can also standardize data collection with AI by utilizing AI to stand in collection and analytics. This can improve resource allocation. We can also do decentralized data security. And we all know that this is through employing blockchain for data decentralization and security, ensuring privacy while allowing for authorized access. Another thing that can also be done is capacity building by training staff on data security protocols and efficient electronic health records management to optimize patient data handling. And that was my presentation. Thank you all for listening.
Thank you, Abdallah, for that powerful presentation. It was very informative. We have really learned, we have understood more about primary healthcare. Yes. Yeah, and from your presentation, we have learned that yes, these services are very essential to the well-being of human beings. Services ranging from preventive, promotive, rehabilitative, curative, all these. But unfortunately, to access these services depends on whether you have the money. It depends on the economic status of the patient. With the patient with low income facing barriers, and they're the most affected when it comes to healthcare access, when it comes to accessing these essential services. We have also learned that our healthcare providers are traveling abroad where working conditions are conducive for them. And also, we have also learned that shortage of medical supplies in the hospitals, and also dependency on external donors is also a challenge. And that's why at Actuate we are empowering people to be the custodians of their own well-being. Since the government, you have also taught us about the role of government in ensuring PHC, but since the government itself has failed, now are we are trying to bridge this gap. How can we empower people themselves to be custodians of their own health, to raise the money that is required and all that? So thank you once again for the informative presentation. So in case maybe people have questions, you can type them. But meanwhile, I will welcome our CEO, Dr. Masharia, to give us additional remarks about the topic. Doctor, you're welcome.
Thank you, Glory. Thank you so much. Can you confirm you can hear me, Glory?
Yes, Doc. Yes,
All right.
We can hear you.
All right, thank you. And thank you, Mr. Muita. Wow, primary healthcare, PHC, that's a very hard topic to crack. It's only hard. Let me tell you why it's hard. It's only hard because the science of the administration of primary healthcare, the science we use for administration of financial healthcare, does not allow us to gain access to the people in the primary healthcare settings. People in primary healthcare settings include individuals like yourselves, families, and the communities. Now, the science of money, let's say, is the science of money that we use for financial administration in healthcare is known as centralized finance, which, as we have said many times before, is based on the economic theory of equilibrium. Is equilibrium. It does not admit randomness. And you see that comes from Adam Smith's work in 1776 when he published The Wealth of Nations. Unfortunately, when Adam Smith published that work, people running government institutions, they took it as the holy grail and became the underlying theory for financial administration for governments and government agencies. They are centralized. That's why we have central bank and such agencies. So as Muita has told us, is that I think number one greatest challenge is funding. The government is allocating 11% of the national budget. 11% sounds very, very good. Yeah, on paper, 11% sounds very, very good. But when you look carefully into that number, 11% or even 10%, even the World Health Organization recommending 10%, they are saying 10% of what? That's the question. See, that's the whole problem with all this mathematics. 10% of what? 10% of the money that the government is able to collect from people, which they call the GDP, or the earning potential of people. Now, I think I'll surprise you, if you're not surprised already, that the government does not know what more than 90% of the people are doing in the country. From the economic perspective, that 11% represents less than 10% of the economic activities of the individuals in the nation. This is why it is less than 10%. Number one, if you have cows in your own household and they're producing milk, you are milking those cows and you are selling the milk to your neighbors, that financial transaction does not appear anywhere in the eyes of the government. Or even if you have chicken and the chickens are laying eggs and you're selling those eggs to your neighbors in the village, the government doesn't know. That is very, very, very basic level at the community level where people are living. So it goes beyond that. That even if you're actually doing your large capital transactions, and that involve money. We say large involves maybe hundreds of thousands of shillings that involve money, and you can sell your product directly to your customers. The government does not know that you have conducted a transaction, so that work is invisible to the government. Now, I can tell you that in a country where more than 80% of the people are subsistence croppers, that subsistence cropping economy does not show up anywhere in the balance sheet, even the balance sheet of the Central Bank of Kenya, neither does it show up in the balance sheet of the Kenya Revenue Authority. So Kenya Revenue Authority does not have access to what is called subsistence economy. Yeah, is that now the only way, and you see this is why they're trying very hard to even collect money taxes from M-Pesa transactions. That if you send money to your mother, and I heard recently that the KRA wants Safaricom to submit all the data for M-Pesa transactions so that they can actually tax that money. But in the past, that money has never been taxed. I'm not saying it's good for them to tax that money. It just means that is a whole lot of money, which makes more than 90% of the transaction volumes that do not appear in the tax balance sheet. They don't show up. This means who now is paying these taxes that they're talking about 11%? 11% is only for those people who have formal employment. For example, if you're employed at a company where in Nairobi City or wherever else, and you're earning a salary and that company is reporting taxes, then that shows up in the balance sheet. And then you ask how many people have got formal employment in a nation where the majority of the economy is still subsistence, which is called jua kali. And see, then even jua kali businesses such as people doing handicraft work, even working in those markets, they are making jikos, making furniture. All that work does not show up in the KRA balance sheet. So 11% that we are talking about represents, or maybe about 1 to 10% of what the people are doing in the nation. So the money is paltry, it's kidogo sana. It can't do anything. It's not sufficient. And you see, that is a big problem. Now, when you talk about the social insurance programs, like National Health Insurance, they rely upon collecting money from individuals, maybe voluntarily. Those people are in the subsistence economy outside the formal economy, call them jua kali or subsistence people, are now supposed to be paying voluntarily money to this National Health Insurance Fund. How many people will volunteer to pay money? That's the question. Until somebody gets sick and says, oops, oh, we don't have NHIF. That's when you remember that you are not paying NHIF. So the model that is being implemented now, it's only for an economy where there's 100% tax-based coverage. See, if you're having 100% tax-based coverage, meaning that the government has access to everybody and everybody has records are centralized and they are collecting money, then that model can work. You see, it's based on this Bismarckian theory. Bismarck was the one who introduced this kind of centralized health service in Germany, in the late 1890. So it's based on Bismarck himself. And then it was adopted in the entire European Western world and the World Health Organization. But it will not work in a place like Africa. You see, Germany, by the time it was doing that, they had a full registry of everybody, all the German citizens, and they could account for everybody. And then they had a social system or socialized system where everybody's contributing to the social, the social bucket, let's say. And so then all you needed to do is be a contributor to that because you're inside. So every German citizen or everybody living in Germany could get is accounted for. Now government does not account for everybody. Yeah. They are, you see, or even government leaders, they're like not so much interested in finding who is where, what they do every day. And most of the businesses do not contribute to that 11% they're talking about. Yeah, but that is a big problem. And then when they don't contribute, then we don't have sufficient funding for all the things that we need. For example, to buy medicines, even to manufacture medicines, even to manufacture medical equipment, we do not have any medicine. And so we become dependent on donors, external donors. But you see, external donors enjoy that very, very much. If we do not find out how to get full coverage, such that 90% of the people are not outside, but they're inside somewhere. If we don't get that, the external donors become very pleased by that. It's very pleasing to them. Why? Because they can use that as a manipulation, a political manipulation, instrument. Because they can tell you, if you want this money, you have to do this. If you want it, so they make conditions for you to receive that donor money. So we become susceptible to manipulative international politics, geopolitics, that then we are controlled by other people because we cannot stand on our own. And where we are failing is understanding our own people so that we can actually get everybody participating in contributing to that 11%. The government can't do that because the government is already compromised, because the government itself was not created spontaneously by ourselves. This is a government that was imposed on us, after independence. This is a colonial government. And so the colonial masters would not like us to discover how to expand the tax base, even to understand how we can expand our GDP, because if we did that, we are going to be economically independent. And if we're economically independent, we cannot be manipulated. Okay, but then it is not all gloom because the blockchain is here. And the power of the blockchain, the fundamental power of the blockchain, besides it being secure in all the transactions and having privacy and all that stuff, the power of the blockchain is power in decentralization, to create a new science of decentralized finance. Instead of now talking about that centralized finance that's based on Smithian economy, Adam Smith, who rely on mathematics of equilibrium, decentralized finance comprehends disequilibrium, the randomness. That means decentralized finance comprehends by itself something very deep science here. It comprehends the emergence of health in a human being, individual human being. So decentralized finance can comprehend you yourself as a person where you are. Unlike the centralized finance, which relies on central administration, such policies and rules and regulations that are created from the top and then administered down, decentralized finance is the opposite. That the rules and the regulations are created by yourself as an individual, because decentralized finance is accessible to you through your own cell phone. It does not require intermediaries or some people to sit out there up at the top and then make decisions. And decentralized finance can achieve full coverage when you're talking about the tax base. Now, if you want to know how to reach everybody, and the reason why KRA is going to Safaricom is because everybody, every family, every household has got a smartphone. Every household in the whole country. Okay. Now, decentralized finance can be delivered through the smartphone, through your smart wallet, like a trust wallet in your smartphone. So it does not require you to ask permission from anybody else. All you need to have is a smartphone. And when in that smartphone, you put Actuate token, then the Actuate token becomes the tool or the substrate for giving you access to all these good things that are there in healthcare, from primary healthcare. Now, tokens like Actuate are cryptocurrency, they are money. So when you're talking about funding, you begin to understand the answer to the funding problem, the funding challenge appears suddenly. Where there was no answer to funding, when you thought that you had to go out there and borrow money or look for grants from some external sources, then you discover if everybody has got Actuate token, and then here's the kicker, that the Actuate token, people don't have to give away their tokens in order to create what we would call a health risk pool. That means to gather money or to form capital for funding primary healthcare. They actually do not have to give away their Actuate tokens. All they have to do is send transaction to one another, just like the way you pay money with M-Pesa, sending M-Pesa. And then the blockchain collects a small fraction of that transaction, called a small fraction called a transaction fee. And all that money is put together into one pool of money, which becomes a health risk pool. It's a risk, because it's a risk pool because everybody is at risk of getting sick at any one time. And sickness is random, as we said. So because these transactions are happening every single day, and they're happening from wallet to wallet, peer to peer, individual to individual, then you can imagine the number of transactions happening every minute. Supposing now the transactions are going at 70 transactions per second. Yeah, and I believe they are going to be much higher than that in the next few years. 100 transactions per second, and in the blockchain is extracting 0.01% fees, which is called the gas fees, and all that money is getting put aside into a health risk pool, and this health risk pool becomes available for paying for health services. Okay, so that's one major way of solving the health access problem, because so long as you're engaging in a blockchain transaction, you're selling your tokens from one another, you will be guaranteed to receive primary care at the nearest delivery center possible, whether it's dispensary or community health access points. See that? So that's one thing, and we have to work very hard. So in our summit, we're going to be announcing a hackathon for creating such a smart contracts for building health risk pools to allow universal health access. Now it can become universal health access to primary health because every single family has got a smartphone. And people would do that without even having to pay taxes. So instead of talking even about 11% of the GDP, we're talking about 100% coverage. That's universal coverage. Now, this traditional way of saying 11% is 11% of what? Of maybe 9% of the people who are participating in the national kitty, in contributing money through KRA. It's only, so 10%, 11% of 10% is what? Is 0.001%. You see? So when they say 11% or 10%, they are not being genuine, they are disingenuous, they are disinforming the people. But now we have the technology to get 100% coverage. And that's what we must work together, no matter what they say. Number two is that the community health workers who are at the forefront of disease prevention by educating families, community health promoters. Now, blockchain tokens themselves, the blockchain is able to reward those kind of people directly for actually doing a good job. And you see how it's going to be implemented. That's another smart contract that if a community health worker does good job talking to mothers who are breastfeeding, teaching them about how to breastfeed properly and stuff like that, getting immunization, they get awarded tokens. Okay. Even the mothers themselves get awarded tokens for good motherhood. Because that work that mothers do, also you're not going to find in the balance sheet of the KRA. The Kenya Revenue Authority does not recognize the job of mothers. Even if all those people working in the Kenya Revenue Authority were brought up by mothers. None of them showed up in this planet in any other way. But if you ask them, what's the value of the work that your mother did for you? Can you show me on your balance sheet? Where is the gross domestic product? Where in the gross domestic product that the value of the job of motherhood appear? They say, what is that? As if it doesn't know. Even you would say a man like that would be working at KRA, he would be having his own wife, doing work as a mother, raising children for the family. Even say a lady working there also has her own children, but she does not recognize that the KRA itself does not recognize the value of the work that a woman does to raise the family or to take care of the kids. But now the blockchain, interestingly enough, the blockchain is able to capture that because the blockchain is built on a new science, the new mathematics of decentralized economics, the mathematics of communication, mathematics theory of communication. For those people who don't know what that is, mathematics theory of communication, I ask you to read the paper on mathematics theory of communication so that you may understand what it means. It's a different math from the mathematics that relied upon on creating the old economy. So this mathematics comprehends randomness. Say, for example, the work of raising children. Whether children are going to grow up, they're going to increase in inches or increase in length or gain weight, all that is random. But you cannot know random things through the centralized data collection system because they cannot predict anything. Random is unpredictable. That is what it is. And because random is unpredictable, the centralized finance system, which relies on prediction so that they can eradicate risk through prediction, does not work. It is incongruent in the centralized, in the decentralized things like health production of human beings. And so that's why we are very, very excited to have decentralized finance. And so mothers will get recognized and rewarded, and the product of their labor, even the labor of giving birth to babies, that product will appear in the balance sheet, but the balance sheet on the blockchain itself. So then for the providers themselves, nurses, clinicians, you say doctors, surgeons, even when they work, they do a lot of work that nobody recognizes. Yeah, and you see, that's why we're talking about healthcare human resource and the burnout. And doctors and nurses leaving the country to look for greener pastures elsewhere. The reason they are going away is not because they are not needed in the country, but the value of the work they do does not appear anywhere in anybody's balance sheet, particularly in the KRA, does not recognize a doctor who works, even a nurse who is working for 24 hours. They take that for granted. All that value that you're producing by saving lives, nobody cares about it in the centralized finance system. Let's say maybe you can say people care about it, but they cannot see it, they cannot recognize it because that doesn't show up in the balance sheet. So what do the doctors and nurses do when the work they do, the value of the work they do does not appear in the balance sheet? From time and again, they go on strike, trying to force the people in the centralized finance system to see, can you see the work we are doing? What if we stop doing it? People are going to die. And instead of them responding that people are going to die, they go to Cuba and import new doctors because they think that Cuban doctors are also stupid. It is not because the Cuban doctors are stupid, but because and these decision makers cannot actually comprehend. They can't comprehend the value of the work that you are doing in the hospitals, and they cannot comprehend that because the balance sheet that they have do not have any single line item saying this is the value of the work that the nurse is producing. This is the value of the work the doctor is producing. And so nobody knows. If you save somebody's life, yeah, what happens? Does that show up in the balance sheet of the KRA? KRA cannot tell you that because you were there, you saved somebody from getting knocked out by COVID. This is the value that you produced in this our balance sheet. You see that? So that incongruence between the balance sheet and the value that people are producing becomes the source of big challenge. But then good news is that, and I want to tell you good news, is that we have now the technology that resolves all that. The value that the nurses and the doctors are producing will be appearing in the balance sheets because that value is recognized by the consumers themselves, the consumers of care. That means the patients and the families. If somebody gets sick, goes to a hospital, and somebody is treated well, and then they recover and go home, the family is happy. Yeah. So now the family can actually, but nobody goes to ask the family, what would you say about your father having been discharged from the hospital and now is doing very well? KRA does not care. It does not have that entry, that data entered anywhere in its balance sheet. It doesn't say that, okay, this father went back home, so he can now continue, providing for his family. He can go and dig trenches, make more money for his family. That doesn't show up. So, but the family itself will appreciate. And so when a family that's appreciating that their father has come home and is now continuing to work to fight for the family, how can the family express that? Family can express that through the blockchain. It can actually, say that the care that my father received was good, and then it can give points. It can give reaction, just like the way if you read a nice article on Facebook, you can react to that article by liking it, and if you like it, you can even give it much more. You can give it much better reaction by loving it or even celebrating it or something like that. And now, those reactions can now be monetized through the blockchain, that everything you like becomes a reward to the provider. See that? And so each provider is going to receive Actuate tokens depending on how many people are loving their work or how many people feel comforted by the work. And so we now going to have to build a smart contract also that helps to reward people for doing good. For example, if you exercise excellence as a nurse, or if you exercise excellence as a physician, and that excellence is felt by the consumer of care, that means the patient or the family or the individual who is receiving care, that patient will receive notification on their cell phone and say, how can you rate the care that you received? And we say, how do you rate the care that you received? Was it good, excellent, bad, so forth? Now, if it was good, then you get certain amount of tokens. If it was great, you get even more tokens. If it was super great and you liked it very much, then you get even more tokens. So what I'm saying is that we have the technology for doing that right now, rewarding providers, paying providers for doing good. That means they don't have to wait for money to come from a centralized system to come and pay them, but the money comes from the consumers who are happy So rewarding positive behavior. And so those are now two instances. Now you can see the third level now says raising money is what we call quadratic funding. So right now, the trouble in Africa is that a lot of, I think nearly all, 100% of the medical equipment or pharmaceuticals are imported. We imported them from, we had been importing them from Europe. We've been importing them from the United States or even from India now and China. Well, the problem is that we are not even allowed to manufacture our medicine. But the problem is not even manufacturing, it's the funding. How do you raise money to manufacture, which you call translation science? How do you raise money to take the knowledge, say pharmaceutical knowledge, from the university outside to make a factory, start manufacturing tablets, and then distributing them, and so they can appear in the hospital shelf, in the hospital pharmacy. Okay, how can you make medical equipment, say from a place like KU or even University of Nairobi? How can you make new medical devices and then manufacture them? Build a factory to manufacture those devices, and then you distribute them to all hospitals in the whole country. We don't have the capacity to do that because that takes a lot of money. That now comes to fundraising that requires, or say, forming capital that to the tune of $1 million to 100 million, even to $1 billion. Yeah, and even $10 billion. So how do you raise that money? Today, not anywhere in Africa have you got the capacity to form capital, and that is done by design. Capital formation is done through the Capital Markets Authority, like say, which runs the Nairobi Stock Exchange. But you have never had Nairobi Stock Exchange or the Capital Markets Authority coming to work with people in universities and teaching them how to form capital to fund their projects. Instead, the universities form what's called enterprises. And these enterprises, they are relying upon donation money by getting students to write grants and then competing for grants from European donors. Now, who would lie to us that Europeans have got so much interest in getting our projects into market? The only thing you can know is that from history that Europeans have colonized us, and they are not going to hesitate to collect all the knowledge you have, to take it out there in Europe and make their own medications to come and sell to people in Africa, or even to sell them to their own people out there in Europe. But now we don't have to wait for those grants because quadratic funding is a fundraising mechanism that is on the blockchain that will help us to raise inordinate quantities of money, because quadratic funding is done through the decentralized finance platforms such as Uniswap, PancakeSwap, or even SushiSwap. Let's say these are DeFi platforms, which now are open to everybody. Traditionally, the capital market or capital formation was the job of the centralized structures like Capital Markets Authority, which correspond with the Nairobi Stock Exchange. But then you see Nairobi Stock Exchange is highly important because none of the companies listed there are working on behalf of the local people in the country. Just look at who is listed in the Nairobi Stock Exchange. You find those companies are European owned, including Safaricom, Equity Bank. They are not owned by Kenyans, you see. And so decentralized finance now puts people in the center stage, because if you have the tokens in your wallets, your own wallet, you can participate in decentralized finance uninhibited. There's nobody who is going to stop you from participating in creating liquidity pools to help form capital that's much needed for translation science, because it's very, very expensive process. Okay, so that's why we're even calling the summit, so that we can understand that the specific purpose of the summit. Say, what's the specific purpose The specific purpose is to understand capital formation, something we don't know. Now, if we can form capital, we are going to have serious industry growth, an exuberance that you've never witnessed, because it's not that the money is not there, it's that that money cannot be formed. You see, formation means gathering money together in what in Swahili we call harambee. So harambee has gone online now, but it's more sophisticated harambee because harambee on the blockchain. See, the traditional harambees that we do, most of them mostly prolific after you die. In any case, people are going to come to raise money for you after you die. Now, instead of that, waiting for you to die so that we can raise money to give you a warm send off, which is the language that you hear. Let's go and give him warm send off, so people contribute so much money. But that money doesn't appear anywhere in the capital markets, so it's not formed properly. But you're talking proper capital formation. Instead of talking about warm send off, today we talk about warm send in. We're sending you in to the enterprise to become the entrepreneur who can now create products and services that are going to help improve life. And so when we create products for ourselves, the cost of care is going to drop, because right now, why healthcare is very, very expensive, even if you don't have even though we have only a little money to buy, is because all the things that we need in healthcare are imported. Because if we have to import medication from the United States, from Boston, if we have to import medication from, say, London or Paris, it takes a whole system to transport those medications from those countries to bring, and then they impose tariffs. When they come to the port of Mombasa, then you have to buy what import taxes, custom duty, a lot of nonsense. So what cost only 50 cents in London ends up costing 500 shillings in Nairobi. You see that? So you can see that the cost of care in Nairobi is 10 to 100 times more expensive than the cost of care in Boston. Whereas Boston has got a lot of money, patients pay maybe about 10% or even 1% of what people pay in Nairobi for medical care. Why? Because everything that is in Nairobi is imported, say coming out from Boston. But in Boston, everything that you're consuming in the hospital is made in Boston. Because it's made just next door, even the guy can make a phone call and the medicine is delivered from the factory. It's still hot, it's still steaming, it's coming from the cooking pot, and it arrives in the hospital desk right there and administered immediately. We can never ever make it if we are importing medications from everybody else. We are not making our own. So the whole thing about creating universal health access becomes an illusion in a centralized finance system that forces us to import things we can actually make in our own nation. And what we are going to do is raise money, form capital, so that we can manufacture those products right at home in Kenya. And you see that will cut the cost of care, not only by half, but by degrees of magnitude that you cannot even imagine. Healthcare becomes very, very easily available. The difference is this. It's like going to eat in a 5-star restaurant, say at Safari Park, or cooking your food at home. You see, the medicine that you're taking coming from Boston is like food being served from 5-star restaurants at Safari Park Hotel. And then you can eat the same ugali at 5-star at Safari Park. You pay 3,000 shillings for just a plate of ugali. If you cook it in your house, it's gonna cost how many? Maybe 10 shillings or less, because you have grown the sukuma wiki, you have grown the maize in your own house. Everything is very, very cheap. You see, that is where the money gets lost. So, and I'm pleased to announce to you that at the summit, we are unveiling our biomedical industrial city project, which is going to be the epicenter for manufacturing of medicines, medical devices in Africa. That's a large capital project that we, over the next few years, we are going to start. We're going to build up the place and get manufacturing of all these devices locally. This is not a job. This is not the job of the government, which I think that even public-private partnership will not cut it, because a lot of government's thinking is centralized finance. It has to be fully private sector led, but of course following the government regulations. But it takes about 10 or 15 years for government to respond to such things. So if you see the government taking time to respond, don't worry about it. The government will turn around at one day. But decentralized finance is the solution. I call that type of solution a panacea. It's a panacea in health access. Panacea. Just go and read out that word panacea. And I want to stop speaking there so that you can understand the challenges that we have, including all those other challenges that which are listed for us, including transportation, even building facilities, so that people can get physical access, in telemedicine, and all those things are going to become very easy to do, quite easy to do, QED, with a blockchain finance, because you can form capital. As Markowitz said, Harry Markowitz, this is another assignment for you to read. Harry Markowitz, 1952, he said that no innovation is possible without financial innovation. No innovation is possible without financial innovation. And he said that financial innovation is required and sufficient condition for any innovation to occur. And then when Markowitz was saying that, that's in 1952, so he invented the discipline of financial engineering to help people innovate money. And you see, financial engineering has multiplied the GDP of nations like United States by thousands of times. However, we in Africa have never even understood financial engineering, although financial engineering is taught at JQuat. But that financial engineering is only known at JQuat alone, but not even by everybody in JQuat, just a few people at JQuat who are studying financial engineering. But right now, we don't have to worry about that insularity that's just a few people knowing. Financial engineering on steroid is known as decentralized finance. Decentralized finance. And you can see now the prophecy of Markowitz, who said that innovation, financial innovation is required and sufficient. He said it's necessary and sufficient, meaning that you don't need anything else. You just need to innovate money. But then all other innovation takes place. And because we now have fully accessible financial innovation technology known as the blockchain, ladies and gentlemen, I welcome you that we enter into financial innovation by, first of all, you will participate directly in this financial innovation. That is the required and sufficient condition for any innovation to take place by, first of all, creating a liquidity pool. If you do not know how to do that, get to learn very quickly, because if you don't do that, you're going to be left behind and you'll be crying, you know. So we don't want to be crying when you say, why did I not know this? Yeah, there's no reason you don't know this, because I've told you already. Create a liquidity pool with the actual tokens you receive. Okay. Then to create a liquidity pool, you need what's called another pair, like BNB, another token like BNB to create a liquidity pair, LP, liquidity pair, so that you tie the actual token with BNB token, or you tie actual token with Ethereum token, or you tie actual token with Bitcoin, whatever you choose, and then you put that in a liquidity pool. if you don't know how to do that yet, because we've been talking this for a year, is you need to learn that right now, because I'll tell you the significance of doing this. When you create that liquidity pool, you obtain an NFT number. That's called non-fungible token number. That will be your token of admittance to the summit in December. Do not show up at the summit without NFT number. Now that's an insult to yourself. Don't insult yourself by showing up there naked. Come dressed up with NFT number. And that is when you say, I am in the decentralized finance. And when you say, I am in all those good things you have said, this, you're in the panacea. You enter in the panacea. Do not be of them that draw back to perdition. Perdition is that place we talk about 10% of 1%. What is that? 10% of 1%, that's perdition. And we talk about receiving money from foreign donors, instead of participating in creating our own future. So get an NFT number so that you can participate. Then when you come to the summit, you meet people like you who are thinking about the future, the great future that we are going to create together. The future that's universal, where universal health access is possible, where we can actually raise money with quadratic funding to finance our own innovations. That is what that NFT represents. That means that if you show up without that NFT, it means that you do not care about such things. And let me tell you, you don't care about such things do not care about you. So if you want things to care for you, then you care for them. If you want that future to care for you, because it's a future that we can create so that we get the ultimate freedom that we have never been free. I can tell you, ladies and gentlemen, the freedom that we got from what they call independence in 1963 as a nation was all talk. There is no economic freedom. As I told you, if there's no freedom in capital formation, there is no freedom whatsoever. Because as Markowitz said, without financial innovation, all innovation is meaningless, is vanity. So let's go further on the positive side of things. And so back to you, Glory. I think that was long, but I think it's important that you cover that story. Glory, back to you.
Thank you, Doc. Thank you, Daktari, for those remarks. Yeah, so I hope so there's this question from Salome. Salome is asking, as blockchain, how can we help pregnant mothers who are not financially stable so that they can be comfortable even during delivery? Daktari?
Pregnant women. So the blockchain itself, you see blockchain is money. Pregnant women, what they need are three things. One, they need access to food, good food, nutrition. So blockchain, people are working hard, blockchain is going to give them money. And so in order for that to happen, there has to be sufficient liquidity. That's why everybody has to participate in creating liquidity pool. Okay? So that women who are pregnant also receive Actuate token. And what we are saying is that in pregnancy, even next year after the summit, we are going to create smart contracts for rewarding women for taking care of themselves during pregnancy and taking care of the pregnancy. That's how the blockchain will help the pregnant women. One is that as soon as a woman misses her period, it's called the last menstrual period, LMP, she suspects she's pregnant. Yeah, a woman of childbearing age who is sexually active misses a period, she's 100% of the time she's pregnant. Okay? She has to go and start receiving prenatal care. So by going to receive prenatal care, then she receives tokens. She begins to receive tokens. And the tokens are administered by the smart contract. And that's where it begins. when the first prenatal visit, the woman, the mother, that's the expectant mother, will get a list of appointments to follow. If she goes and meets all those appointments, including all the vaccines and all the ultrasounds required to ensure the baby is safe, the pregnancy is going on well, all the exam, yeah, then she is going to be receiving tokens for every exam. And that's what we want to build, a smart contract for that, such that it's possible for a woman to receive tokens on a monthly basis for doing, for just being pregnant, because she is carrying a human being who is going to contribute to the economy in the future. It's like she gets paid for that good job. And that's what I was saying, that the work that the women do to take pregnancy to term does not appear anywhere in anybody's balance sheet, including KRA. But today we have a technology that will help to put that on the balance sheet. So then, if the woman now she's at ready to deliver the baby, she delivers the baby well, and it is certified by midwives. During the she also receives tokens for that, and then she gets all the vaccinations necessary, and even takes care of the baby after delivery for the 1 year of life. She's following the treatment programs. I mean, the Well Baby Clinic and Well Mother Clinic. She also receives tokens for that as well. So that's what we are talking about. So Salome, the blockchain is going to help pregnant women in a way that was never, ever, 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 ever even possible to think about in the past, because women will be rewarded for carrying pregnancy to term and bringing us new human beings into this world who are free of diseases or complications. And even pregnancies that are not monitored properly end up in serious problems. Either the mother dies or the baby dies, and or comes up with many congenital malformations or diseases. Yeah. So basically, that's what I'm saying. That is where the smart contract is going to be very useful. So we're going to talk very deeply about that issue at the summit, because it's important that everybody gets to understand how that is going to operate, and we get smart contracts developed by our the blockchain teams in hackathons. And we have those smart contracts where we'll be administering tokens for, you could say, positive behavior, health-seeking behavior for pregnant women, and even for mothers after giving birth to the baby. Okay, any other question?
No, there is no other question. Talk. So, ladies and gentlemen, as you've heard, we will unpack more in our upcoming summit and also subsequent sessions. Yeah, we have a very big event on December, from that to 6th of December this year at Kenyatta University. And for that matter, I will welcome our president, the president of the summit, Mr. Augustine Narokwe, to give us updates about the summit. Augustine, you're welcome.
Thank you so much, Glory, and good evening, everyone. I would like to say thank you so much for joining us this evening for the powerful presentation by Mr. Abdallah Muita. That was so informative And we would like to say thank you so much, Muita. And also thank you so much, Doc, for making time to join us and shed more light in this topic. So, ladies and gentlemen, as you have heard, the summit has been mentioned through this session that we have the Nairobi um, pre-Boston, the pre-Boston Nairobi Summit, which is going to take place from 3rd to 6th December. And it's all about how we can use Web3 technologies. Web3 technologies, that is blockchain and artificial intelligence, and also decentralized finance in blockchain to improve global health and development. So, a lot has been mentioned. I would love to say that the progress, the going has been well. Uh, the journey has been long. Um, the whole of this year, and we are so much grateful the far we have come. A lot of partnerships, right from technology companies, research institutions, academic institutions. We have closed a lot, and currently we have 7 workshops, uh, right from STEM workshop, health access workshop, environmental health, water and nuclear and nuclear energy workshop, mental health workshop, information technology workshop, and others, and cybersecurity. And those workshops are featuring in our speakers, so many of them, 100, who are gonna speak the topics around those workshops they are aligning. Um, so um, so it's just 19 days, 20 days to the event, and as we all know, I think you have been seeing these news in our community about the free pass. I would love to emphasize on the free pass opportunity for all of you. That free pass opportunity is there for attendees. So it's no longer $150, but a more it's a strategy of ensuring that we ensure that this event is what is centered accommodate everyone. And blockchain, I think, and I think we all know that this is just freedom that is coming. Uh, we usually go to events. You go to an event, and then you go sit down, listen, maybe network if it is possible, then go back home. But this event is unique in a way that it will uh, it at the end of the day you're going to retain your what you're going to is presenting an opportunity for you to be represented in the blockchain world by acquiring the NFT number. So that NFT number, despite giving you access to this to the summit, you're going to be available in the blockchain and recognized. So look at it in that way. You're not giving money to anyone. That 1,000 shillings you are ensuring that you are available in the blockchain world by purchasing 5 tokens, create your own liquidity pool, come with that NFT number, and dine with us. I don't think anything like this ever happened even in all crypto and blockchain events. This is so unique because we believe in empowerment, we believe in community, the power of community. So um, I will share again right away before we close this meeting that article, go through it and do the necessary. Okay, we have been seeing this, that you should be part of this. Please reach out to me, uh, and I will give you the way forward. If you don't know how to create the liquidity pool to buy the tokens in the PancakeSwap, we are here to help you so that you can register your NFT number. It will help us, and we are really moving. We are working with all institutions to ensure that all students from STEM, from mental health, from environmental health are there. Okay, because when you look at what the vision of Actuate Biomedicine is, it's all about actuating the local knowledge, and local knowledge is available at a greater percentage in our local institutions. So there's no way we can start talking about audience without um, including students. So we are prioritizing students because that is the generation with knowledge. That is where the knowledge is. These are people who generate knowledge minute after minute, all right? And we need to ensure that they listen, they come and listen and learn, that their knowledge can really transform our continent. Okay, it's very easy, and I will not wish not to see Alex Diana there. I will not wish not to see someone like Salome there. Please approach me with your NFT number. I want to register you guys to the slot, and it's really getting exhausted. We are working with student leaders, Institute KU, uh, uh, top leadership, universities top leadership, that right from VCs, to ensure that this message goes to everyone. So do yourself a favor and don't miss that opportunity. Secondly is the pitching competition, whereby we have that pitching competition, or rather poster presentation, whereby there are rewards and certificates. One is the paper certificate, and the second is blockchain certificate. This is an incredible opportunity also to showcase your project, your idea, and despite winning these rewards and certificates, you're gonna network and increase your visibility, and you are, show yourself to this world. We are going to have a lot of people, top people, right from VCs of all universities, ministries, Ministry of Health, Ministry of Land, Ministry of Trade, Investment and Industry, MITI, and others, institutions like Cambridge. I'm just from talking to Dr. Kamad of Virology Department at Cambridge. Those are people who are diving into surveillance and diagnostic and drug, assessing the drugs development and a lot of research. And Dr. Madi, together with Stephen from the Department of Virology, were very happy to hear this, and they're gonna be part of us because they understand. Okay, And what is there is that what they said, and also yesterday, someone also mentioned something like that um, for instance, the Registrar of Corporate Affairs at KU yesterday mentioned to us that some years back, some people came singing for them about the AI, but nobody was bothered. But right now, AI is in everyone's mouth. The same thing we are doing here, we are singing DeFi blockchain to everyone. Okay, don't get bothered, but it's gonna be in everyone's mouth. Not longer, but immediately after this summit. So ensure you be at the forefront when the explosion occur. Okay, don't be left behind. So a lot of progress has been happening. We are so much grateful. Exhibitions right from the Chandaria Center, a lot of incubation projects are gonna come. A lot of incub- the projects, the startups, and Kenyatta University Teaching and Referral Hospital are gonna be there. Cambridge is also likely to come with some of their exhibitions, and all other people. I can't mention all of them. Okay, so ensure you be part of this. Grab your NFT number and link up. Um, the sponsorship challenge is still ongoing. We have secured a lot. We have interacted with a lot. You have heard about the biomedical city project coming up, uh, mm, making the headlines during the summit. It's gonna be at the center of the summit, the biomedical project. A lot is happening, and I can tell you that you will not wish to not be part of this great community, okay? Because we are redefining the African continent, matters health and even other areas, okay? So, yep, grab your NFT and we'll link up soon. Thank you so much and have a good night. Back to you, Glory.
Where did Glory go? All right.
Sorry. Thank you so much, Augustine, for the summit update. Guys, as you heard, it's a groundbreaking event. You don't want to miss. As Augustine has said, we have invited dignitaries from different sectors. We will have the Ministry of Land, Ministry of Health, and many others, and other prominent leaders in our summit. And the good news is that we are accommodating everyone. We are not leaving anyone behind. That's why there is the free pass, whereby yes, the fees for attendees is $150, but now we are accommodating everyone. We introduced free pass a way back, and as Augustine has highlighted, that you don't need the $150. You only need to create liquidity pool with at least 5 Actuate tokens, and then after you create the liquidity pool, you get the NFT number, and now the NFT number is what you will use as your ticket. So this is a golden opportunity for everyone. This week, let's all finalize in doing so, and registering. Let's not miss this chance. So I encourage all of you. And in case you have a challenge in creating the liquidity pool, I have shared my number. I have shared my number on the chat box. You can always contact me, or you can contact Augustine. Yeah, about the same. Don't sit back and yet you are experiencing challenges. So again, I encourage everyone to participate, because even all these challenges we are talking about healthcare, that day now we are going to engage in conversations that will result to solution, and let's all be part of it. And as I always say, that there's nothing about us without us, so we must be there for the discussion. So I encourage all of you to register. Yeah, so we are coming almost to the end of the meeting. Maybe Doc, if you have anything to add about the summit. Yes.
Oh,
Doc, you're welcome.
Something I just would like to add the people, point of encouragement. You saw the US had elections last week. We have a new president. A new president is pro decentralized finance. It's pro crypto. This is President Trump. He has his own NFTs. So if the president of the US has an NFT, now why don't you get an NFT? And when he was elected, just people did not even wait for the ground to cool. That the Bitcoin price went high. It went up like 10% overnight. Right now, it jumped from about $67,000 to $91,000 yesterday evening. I think by now it's about 94,000. One coin. That's the thing. It means that the blockchain has been admitted into the finance market. Okay? And because there's nobody who, if the president is in, then who else? So all that narrative you've been hearing that crypto is this and that, it's scam, all that kind of nonsense. Now it cannot be nonsense, and the Bitcoin is $94,000 a token, a coin, and Ethereum is about $4,000 a coin. And this is why this is the right time for you to get. Now getting create a liquid pools, because as the the crypto market is rising in general, the cryptocurrency market is gonna rise here forward. At least for the next 4 years, we have a president who is pro crypto in the United States. And that means that crypto is going to rise on a continuous basis without stopping for the next 4 years. So that NFT number we are talking about, it could look like a little investment for you, but it's going to multiply ballistically. Now, the actual tokens that you're getting will multiply in value, because as soon as people understand what we are talking about here, that is a token for universal health access. As soon as people understand, not only in Kenya, but even throughout the world, because universal health access is needed everywhere, then the actual token is going to rise in value. And so that's the reason why we want to give you the free pass that also teaches you how to get actual token and create a liquidity pool. So then when you create the liquidity pool, do not off-ramp that pool. Now that is not clever. Be a smart person, hold onto your tokens, because what's going to happen over the next few days, over the next few weeks, is just incredible. Like what you have seen now with Bitcoin, rising 10% overnight just because the president. And then now we can imagine even by the end of this week, most likely Bitcoin will become $100,000. So let me tell you, if you buy the BTC today and tie it with actual token to create a liquidity pool, that BTC value itself would be rising That's why liquid pools are very fascinating, because as the other token rises, your token rises in value. See, that's what you want to understand. This pairing mechanism is a super genius type of work, because it helps to raise the value of the tokens, that utility tokens that we are creating. And one more thing is that the Biomed City project is a very large capital project. It would involve billions of dollars, a multi-billion-dollar project. And Actuate token will underwrite that Biomed City project. Underwriting means that if you're going to receive money, say from international finance corporation or a syndicated finance group to finance that, and saying they inject something like $1.3 billion. Instead of wondering how shall we pay back that $1.3 billion, we say that we have the actual token itself. To stand is a title, it's the title deed that now, and of course, such organizations are now, because of the positive political influence on the crypto, that now even financing organizations are willing to take cryptocurrency as assets to underwrite projects. You see that? So it means that we can underwrite, and we are underwriting the financing for the biomedical city project with the actual token itself. Now, if we are writing the funding for the biomed city with which is about $5 billion, and you hold some of that actual token, your tokens are going to raise in value because they have ultimate utility. And of course, that means that the tokens shall be used for tokenizing all that real estate project, which is going to be on about 5,000 acres of land. It's a very, very big deal. It's a big deal. That's why, again, you do not want to miss all this announcement. The festival that's going to be pouring out there at KU is just intensive. Okay. And as Augustine said, we have invited all the universities through their vice chancellors. Can you imagine? There are 63 universities in Kenya. Every single one of them, vice chancellor, they have received invitation. Yesterday, we had a great meeting with a registrar of corporate registrar at KU. And she's actually, as Augustine was saying, that they don't want to miss decentralized finance the way they missed artificial intelligence. Because there was a summit, some people approached them about AI, and then they did not take it seriously. And then they said, we're not missing this one. You see that? And I advised that if we want the university to come, we talk to the vice chancellors in every university. So we are doing that. And then other people who have agreed to come is Kenya Association of Manufacturers. And you see, they have a list of companies, all the manufacturers in Kenya. They are going to be there because there's a big question. How can we expand our own manufacturing capacity by using locally produced knowledge in our universities to expand our manufacturing potential or manufacturing base? And of course, I had a very serious conversation with KM yesterday, and they were saying to me that the knowledge coming in the university is not of good quality enough to appear in the supermarket shelves. And I said, what is that? Is the university not the place that produces PhDs of quality? Where does the idea of quality come from? Is it not in the university? So it is not that the knowledge in the university is not of quality good enough. There's a problem. And that problem that is inhibiting our ability to take that knowledge from the university and use it to create industries is called capital formation. That's what I told him, capital formation. Capital formation in a centralized finance system does not function. It does not even comprehend the knowledge that you have learned in the university to the capital formation because in say the Capital Markets Authority doesn't care whether you went to school or not. You could have stayed at home for 4 years and it wouldn't matter. But decentralized finance cares about your knowledge. And you're going to form capital, as I say. We understand how to form capital. We are going to build industries. And so we are very, very excited even to report that we are going to full-blown partnership with the Kenya Association of Manufacturers out there in Western to bring in all the manufacturers in the country. So they're going to come and show their products and we say, how can we form capital to rally or to catalyze more industrial development in the nation? And of course, the Institute for Research and Development also, they're there. So I'm telling you, this week, and you see that you're going to see that in the announcements, updates this week, because there's some very, very good updates. The newsletter that's usually sent by Grace Jerry, and you see all those good announcements. So many good things have been happening this week, and you can see this way you must not miss. But as I said again, do not come without NFT, because coming without that NFT number, you're going to miss the whole thing. It would be meaningless to you, because when you're talking about decentralized finance, then you don't know what people are talking about. It's by getting that NFT, which means having tokens in your wallet, which I believe you already do, taking those wallets, putting them in a liquidity pool, or finding out how to create that pair and getting an NFT number. And the liquidity pool doesn't have to be only 5 actual tokens. You can create a liquidity pool with as many actual tokens as you can. Yes. So remember, you were supposed to pay 20,000 shillings for admission fees. Right now, you're paying 0 shillings. Instead, you are investing minimum of say 1,000 shillings. So you cannot say that now I cannot invest for myself because I don't like myself so much. Love yourself. Okay, you love yourself, so invest in yourself. That's what it is. And get to know the knowledge that's going to liberate you by investing in yourself. So it is written, first of all, you love others, but then you love yourself. But love others as you love yourself. So when you are creating that liquidity pool, that is what's going to give us the power to work together. So if everybody wants to do that, and then you love yourself because it's an investment for you. Nobody is asking you for that money to go and eat it. Hiyo ni pesa yako, your own profit. So you want to keep it that way. And we are very pleased because of that. And I think it's because of all this goodness and being very open that all these people are coming in. Hundreds upon hundreds of people. It's taking a lot of interest. And even KMTC, what I did not tell you, KMTC also very interested, because KMTC, Kenya Medical Training Centers, there are so many in Kenya, and they are inviting their schools, biomedical engineers trained there, nurses, lots of people. And I believe, thank you so much, Moita, and I believe that Gatondo is, you invite all the people in Gatondo Hospital, that level 5, and make sure everyone at Gatondo shows up at the summit. The nurses, the physicians, the medical technologists, everybody. But then you have to leave some people working. Those people are not on duty. They show up for the big festival at KU. But also they come with NFT number, because it's not going to be possible to go through the gate without NFT number. Your ID, your NFT number. Do not come to KU without your ID. Okay? It's a government institution. You come there without ID, you will not be able to enter through the gate. That's a requirement by the law. Even if you not enter into any M3 without ID. But people always do that. But now remember, you are going into high places. You know, you're stepping on the holy ground called the institution of higher learning. You don't go to institution of higher learning without high things like ID and NFT number. Okay? So you want to think of KU as that way, institution of higher learning. Higher learning means it's a place that you go to expand your consciousness. To get there, you need to come with your consciousness ready to be expanded. with an NFT number and with what? With your national ID. That is for security at the gate. They won't let you in without your ID. All right. So, you know. Okay. So thank you so much, Gloria and Mr. Muita. And let's invite all the people at the Todu Level 5 Hospital, from the hospital CEO all the way down to the people who are cleaning the hospital environment science people at the hospital. Okay, thank you. Back to you, Gloria.
Thank you, Doc. And thank you to our topic master, Muita. By the way, Muita has already registered for the summit. Yeah, congratulations to him. And all we are asking from him is now not to come alone, to tag along his colleagues, as Dr. has said. Yeah, let them register, invite all of them. Yeah, so today it was yes, Muita has already registered, so it was a powerful sessions. Yeah, it is only like 2 weeks to the summit. Let's not waste time. Yeah, let's start preparing. So unless there's any other concern, maybe we are almost to the end of the meeting. So the attendance form has been shared on the chat box. Make sure you fill. Yeah, we incentivize learning. We incentivize our learners using our Actuate tokens. So make sure once you receive the Actuate tokens, please create the liquidity pool. And if, as I have said again, if you have any challenge in creating liquidity pool, you can always DM me. So thank you, Doc, for creating time for this, and also for sharing your wisdom with us. And thank you for always having people's needs at heart. And yeah, and to our topic master also, thank you for making time for this. And we are requesting you to join our subsequent sessions and tag along your friends. And to all our participants, thank you for listening, and I hope you have got something. Yeah. So once you fill the attendance form, you are free to leave. See you again next Thursday at a time like now. Bye. The meeting is adjourned.
All right.